It is my honor to now introduce our new colleague from the 3rd District of Maryland, Congresswoman Sarah Elfreth, who's been such a strong voice for the people of her district. Please welcome Congresswoman Elfreth.
Good afternoon. First, I want to echo my colleagues' thanks, not just for the union leaders behind me, but every single federal government worker who is watching at home. We know that you don't hear thank you at all from this administration. Know that the Maryland delegation appreciates your service to this nation, appreciates the services that you deliver each and every day for Americans across this country. Yes, Maryland is acutely and disproportionately impacted by any federal government shutdown, but the folks who are not able to work today are delivering services for Americans across this country. So thank you, first and foremost. Second, I want everybody at home to know that we, the Maryland delegation, we are at work today, we were at work yesterday, we are at work on Monday. We have been here each and every day trying to find a deal to keep government open, to reopen government today, but not at the expense of 20 million Americans who are due to have one of the largest increases in their health insurance costs on January 1st if Congress does not act. And I just want to talk about this notion now, even though we have been here Monday and Tuesday pre-shutdown, the Speaker does not want to negotiate during a shutdown. He's had, as been said, weeks, months to negotiate this. We've known this has been coming since March. And so we cannot do this at the expense of folks who are going to wake up on January 1st, in Maryland at least, with a 13% on average increase for their health insurance. And we all know how important that is, especially in the midst of the affordability crisis too many of our constituents are experiencing, not just in healthcare, but as has been said, at the grocery store, when you open up your BG&E bill every month, when you try to find childcare for your family so you can keep in the workforce. This is an affordability crisis, and 271 days into this Congress, we have yet to address it head on. And we cannot wait 7 weeks to take a vote on extending these ACA tax credits, because insurance companies are sending those letters about January 1st today, on October 1st. We have to act, and that's what we are standing for. Now, everybody here was elected to do something. We were elected to make the lives of our constituents and Marylanders and Americans better. But they also elected not to leave anybody behind when we didn't have to. And so we need to stay focused on those 20 million Americans, 190,000 Marylanders who are impacted if Congress does not act on these ACA tax credits. And we will reopen the government when we get that deal. And that's what's on the line here. I also want to let everybody know that we are working, our offices are working. Please reach out to us. We will be answering every phone call, responding to every single email to be there for you. And as been said, we are disproportionately impacted, which is why Senator Alsobrooks and my colleagues have introduced a bill ensuring that if the Republicans in Congress were here, maybe we'd move on this bill. But ensuring that if you are an essential employee and you are working today and not being paid, you would be eligible for the unemployment insurance that you've spent your career paying into. Right now, you cannot get that. And more than half of Americans are living paycheck to paycheck, and we are leaving them behind in this moment if we do not act. So I want to thank Senator Alsobrooks for being my partner in that piece of legislation, everybody behind me for keeping focused on delivering services for the American people. And thank you all for being here. I'm going to turn it back over to Senator Van Hollen.